but that's where the innovation is going. And you know, I like what you were saying before about these can bridge, the CDK4/6 inhibitors can bridge patients for a long time, and sometimes just then open up other options for them down the road because they would have improved their health, you know, and their organ function to the point where they can get additional therapies down the road. And it may also just, you know, have the availability of new agents because they're coming so quickly for them. You know, how do you think about innovation with the medically integrated pharmacy team?
Well, my hope is that all the stakeholders that are involved in oncology patient therapy, so that includes payers, practices certainly, pharma partners, PBM, specialty pharmacy, all of these groups recognize the importance this innovation provides, and to make sure that we establish a model, dare I say a business model, that's sustainable for this innovation. This innovation has led to CDK4/6 inhibitors as an example to help give hope to patients that a few years ago had no other options or had limited options. And we have to work together, I believe, to keep that innovation spirit in not just the spirit, but environment alive so that these options will continue to be available for our patients.
I just thought about an example that may not even happen or be possible without the medically integrated pharmacy. You know, with the CDK4/6 inhibitors, we don't have to select patients really outside of ER positive, HER2 negative. I mean, obviously other health issues. But think about all the next gen sequencing that's being done and ctDNA and, you know, the PIK3CA mutations, for example. And so that may be in the EMR, but it may have been information that was gained a year ago that isn't available now. Now we have a new agent, you know what I mean? Or the NTRK inhibitors, et cetera, you know, and we have this information there that's lost, you know, unless somebody has methodologies to be looking for this, you know?
So what you just described, and I'm really glad that you brought this example up, is, as I mentioned, the positive quality intervention has really three legs to the stool. The first two legs is communication and education, and I believe we covered that pretty well. But the third component of the positive quality intervention domain, quality standard, is data. And so educating our practices to go into the pathology reports, to your point, to go back and look and see, this patient was eligible for this and has been doing well. They may run out of options, especially if they're in the metastatic setting. Now there's something that can help maybe bridge them yet again. And it takes somebody with some initiative and some education to identify other patients. And so NCODA is partnered with some stakeholders to do some PQI data aggregate studies to show or demonstrate how well these PQIs are positively impacting better patient care.
That's incredible. I mean, you know, NCCN has said that all HER2 negative metastatic breast cancer patients should undergo germline BRCA1/2 testing to see if they're eligible for a PARP inhibitor. And that should happen. So that's one thing, that if it hasn't happened, those are important options for patients. The other is, if you find a BRCA1 or 2 somatic mutation, you need to actually do a germline test for that patient to see if, you know, first of all, for their family and for them, but also to see if there may be, PARP inhibitor might be an option. You can see where, if that isn't sort of systematically tracked, then we're not going to be delivering optimal care for people, you know?
Exactly, and so that's the importance of, again, we're not in the pharmacy, just speaking from a pharmacy perspective, if we're there just to fill prescriptions and not taking that extra effort or step to identify additional opportunities, then we're not taking full advantage of the resources in front of us, which we can at the practice, the electronic medical records that we talked about. And what I see is, I see us, I see partnering with, let's say, our pharma partners, like how they're constantly asking, like, well, how can we help you help patients? And one way that I see them continuing to support the medically integrated pharmacy team is through education, helping us to understand these opportunities so that we have the knowledge to share best practices in a practice, let's say, in one city that is doing the review on this and found certain mutations and was able to affect better positive change or put a patient on a clinical trial because they had the opportunity to look for something that they may not have been aware of.
Yeah, the whole research aspect of this,
Exactly.
because this a tsunami of information, and it's going to need increasingly the expertise, a team. It's got to be a team around information and tracking and optimizing, and it's really interesting to think about, because we all value our pharmacists. We really do. They keep us and our patients out of a heap of trouble, and they're going to. But it's not just that, it's going to be optimizing the treatment going forward, increasingly in these complex times, but very exciting times.
Yes,
it's really cool. So good talking to you. Thank you for educating me. This has really been very interesting. Very great to hear. It's very positive, very positive. So, well, thank you so much for joining us. I have found this to be very interesting, and I hope you have as well, and I hope it's been very useful and informative to you. Thank you.